This video will demonstrate the common physical exams for assessing the lumbar spine. With the lumbar spine, it's a pretty complex area and we'll examine many structures. So you'll probably want to refer to this pretty frequently. This area is one of the most frequent or most common areas that we're treating here. So you'll get the hang of this pretty quick. And the basic exam flow in IMS is designed to help you out, and we follow it pretty closely. So hopefully we'll get the hang of this one quick. Great, so to start out, what I'm going to do is have, usually in the room, the patient starts and they're seated on a chair against the window over here. And we'll start by asking them to stand up, and then we'll do part of the exam over here, but since Rob's over here, we'll just do it from here. One thing to note is, this is a good time to mention it, is if a patient is walking in and they are walking awkwardly, or they have a wide base gait, or they shuffle their feet, or it just looks like it's painful for them to walk, or if they're using a cane or crutches or wheelchair, that is something that in the basic exam template we need to document. It's a general finding of their gait status. And it's important for us to document that they're using a cane, or they're using a walker, or if their gait is antalgic, which would be painful. Oftentimes, the MA or the scribe who is rooming the patient will get a better idea of what that looks like than the clinician themselves, but just make sure we capture that in the documentation. So now I have Rob standing, and now we're going to examine his lumbar spine. We'll usually start by assessing lumbar facet loading. So what I'm going to do, Rob, keep your hips nice and straight as best you can there. Now what I'd like you to do is bring your shoulders back towards me. Lean back towards me, your whole spine. Great. So this is lumbar facet loading in neutral. And again, it's negative, so I'm not going to call it out. Now, keeping those hips like that, we're going to twist your torso this side, like that. Try to keep your hips straight. There you go. And then I'm going to bring your shoulder down towards me. Lumbar facet loading to the left. We're going to do that again this side. To the right. So, no positive findings, so just document lumbar facet loading negative. Next, we're going to palpate a few areas while we have him standing. One test that I like to do with the patient standing is called pelvic compression. This will be found in the IMS basic exam flow. I'm going to press on the sides of his iliac crest. You might feel some tenderness where my hand is, but I'm looking to see if my pressure reproduces any low back pain. So I'm going to push pretty aggressively. Any back pain with that?
No back pain.
Great. So pelvic compression is negative. Next, I'm going to move little posterior and inferior to where we were. And I'm going to palpate here. This is the right SI joint. Any tenderness there?
No.
This is the left SI joint. Any tenderness there?
No.
Great. If it were tender, we'd call it out. Sometimes in this area, it's difficult to see what the clinician is palpating. So just assume that we're going to palpate the SI joints. Then we're going to also palpate the iliolumbar ligaments. Now, as you can tell, they're pretty close in the same area. Any tenderness in there? Okay, his are non-tender. So if you have a question, just ask the provider during the exam, where are you? You know, what are you palpating? Which structure are you targeting? Otherwise, mark it normal. Now, here is his spine. Now what I'm going to do is assess for disc space tenderness. So I'm going to go in between his spinous process and press. Any tenderness there?
No tenderness.
Okay. So I start at the bottom, and this one is L5S1. And then I'm going to move up probably to about L3-4. If the patient is symptomatic higher than that, I'll palpate higher, but usually I don't do that in my standard exam. So 5-1, non-tender, move up a level, 4-5, non-tender, 3-4, non-tender. Centrally, that was the disc space tenderness. Now we're assessing for a little further lateral, we're going to assess for facet joint tenderness. Now, as you can see, it's really close to iliolumbar, really close to SI joint. But you can differentiate when we're testing for the facet joint because we're going to test more than one level. So here, I'm at 5-1. I'm going to move up 4-5, 3-4. Non-tender. We're going to do the same on the left. Tender at all?
No.
Tender at all? Tender at all?
No.
Great. So he's non-tender to palpation at the facets 5-1, 4-5, 3-4. No disc space tenderness, L3-4, L4-5, L5-S1. All right, Rob, can you go ahead and have a seat here for me, please? As we did with the cervical spine, now we're going to assess for his muscular strength, reflexes, and gross sensory for his lower extremities, which are innervated from the lumbar spine. So can you go ahead and put your hands on the side here and brace yourself a little bit. Can you bring this knee up to here for me? Don't let me push down. Great. So that is hip flexion. That's 5 out of 5. Next, I'm going to ask him to kick into my hand, good, and relax. So that is knee extension, 5 out of 5. Now I'm going to pull your heel out, don't let me. Great. Knee flexion, 5 out of 5. Now, Rob, can you bring your ankle up for me like that? Good. Don't let me push it down. Great. So ankle dorsiflexion, 5 out of 5. Ankle plantar flexion with his foot pointing down. I'm going to pull up, don't let me. Good. Plantar flexion, 5 out of 5. Sometimes, if we have a specific idea in mind, we might also examine for ankle inverters and everters. So that would be, Rob, I'm gonna twist your foot that way. Don't let me. Great. So here I'm testing the strength of his everters, and that's 5 out of 5. Now I'm gonna try to twist your ankle the other way. Don't let me. Push this way for me. Yeah, testing his inverters, that's 5 out of 5. Now we'll test reflexes. Again, 2 is normal. If it's abnormal, we'll let you know. Sometimes you can have, so 2 is normal, the scale goes all the way up to 4, so you can have 3 plus, you can have 4 plus, that may be a 2 plus, maybe 3. And that's all right. And then, so we did patellar, and we're gonna check his ankle. Great. Normal Achilles reflex. And again, I'm just demonstrating on one side, but we'll often examine both sides at the same time. Rob, can you feel this?
Mm-hmm.
Does it feel the same on both sides?
Yes.
Okay. So here I'm testing gross sensation. How about in through here, in through here, and in through here? Great. Again, gross sensation is normal. If there was an abnormality, what I would do was call out what dermatome I suspect the decreased sensation. All right, so while we're seated, this is a good opportunity. Sometimes when people have low back pain, it's hard to tell if the pain is coming from the hip or if it's coming from the SI joint or if it's coming from the lumbar spine in it of itself. So in our general lumbar spine exam, we do test out the hip a little bit. So what I'm going to do now is I'm going to test for when I bring his heel in like this, I'm externally rotating his hip. Any pain with that? So he has no pain and no restriction in range of motion for external rotation of the hip. Now I'm going to go the opposite way, and now we're internally rotating the hip. Any pain with that? So no restriction in internal rotation and no pain with internal rotation. Next, so that's going to be found in the hip exam, and you'll just have to click through IMS to get there. It'll be real quick. The next test is called Faber, and I believe this one is both in the hip and in the lumbar spine, so you can't miss it. So Rob, can I have you cross the outside of this heel over this knee, make a figure 4. You can bring it up like that for me. Sorry, over the knee. Oh, yeah, there you go. There we are. Okay. And now just go ahead and relax here as best you can. Relax this. I'm going to put a little pressure here. Does this reproduce any symptoms in your low back? Okay. So this figure 4 is Faber test. So Faber is negative for him. Generally, I'll test both sides. So we can go ahead and let go there. Next, what we're going to do is called the straight leg raise. This one's pretty self-explanatory. So go ahead and relax there. I'm going to bring this leg up. Any pain going down your leg? Any reproduction of low back pain?
No.
Okay. I'm actually going to apply a little more pressure this way and do the same thing. Any low back pain with that? Great. So straight leg raise. In the IMS check boxes, there will be an option to indicate whether he was in a seated position when we examine this or if he was supine. Sometimes I will do both, so if you can be sure to keep track of that, that is important. We'll always examine both legs for the straight leg raise when we're examining the lumbar spine. Okay, so now that we have done that, I'm going to ask Rob to go ahead and lie down with this head down there and face up. The next tests that we're going to do are still part of our examination of the lumbar spine, but they are specific, what we call provocative tests for the sacroiliac joint. Sacroiliitis is a really common complaint for people with low back pain, or a really common diagnosis. Of the 3 main diagnoses for low back pain, one would be lumbar disc disease, the second lumbar facet arthrosis, the third being sacroiliitis. So those 3 for low back pain, we see those pretty frequently. So this test, again, if I were to be reassessing the straight leg raise, I could do it here, nice and easy, and he'd be supine. But I would only do that if he had a positive with him seated. Since that's negative, I don't need to reassess it. But what I'm going to do, Rob, I'm going to have you bend your knee here. Great. And we'll flex up here. And I'm going to bring his hip in there. So what I'm going to do is I'm going to apply some pressure straight through his femur down through his SI joint. Basically is what we're trying to do, is load that up. And this test is also pretty self-explanatory. It's called the SI thrust. So again, I'm basically thrusting down through his SI joint. Any familiar symptoms with that?
Mm-hmm.
Great. So that's negative. Now, if he were to have some pain there, I would ask him, okay, do you have pain there? He'd say yes. And then I'd say, what happens when I do this? And if he says it gets better, then that's a positive test, and that is the reverse SI thrust. So if we're pushing down, that's SI thrust. If we're pulling up, it's reverse SI thrust. All right. You can go ahead and, actually go ahead and just lay there. So those are the main exam flow for the lumbar spine. There may be other areas that we're going to assess, and we'll let you know if that's the case as we go through it. If there are areas that you miss, try to get the clinician immediately when you guys exit the exam room so that it's fresh in the clinician's head what was examined, what the findings were, so that you can document it appropriately. Thank you.